We had a very distinguished guest by our side, Dr. Russell, and he's from the University of Oxford and also Leamington Newcastle Hospital, right? And welcome, Mr. Russell. And first of all, you arrived yesterday, and how was your first impressions about the Congress?
It's absolutely wonderful to be here. I'm very grateful to be here. It's lovely to get away from the British winter, and it's still cold, and actually the sun is shining, which is wonderful. The greatest thing was being able to attend the opening ceremony and see the great attitude of people, the friendliness and the sense of family, which is clear in the Turkish Thoracic Society. So it's a wonderful opportunity to meet people and make new friends, which is great.
And I know that you have been giving multiple lectures during the Congress. And can you give a little brief information about those lectures?
Yeah. Well, I have an interest in COPD. I've always had an interest in COPD. My research for many years has been about COPD. And this is a disease which is worldwide and has implications now and for the future. And I've given a couple of talks on the future of COPD. What will the world look like in 15 years' time? And it's difficult. We hope that we will be stopping smoking more and more. But people are getting older and people will have some more COPD because of it. But we hope our treatments will improve, will become more specific for the right people, so we give the right patients the right treatment at the right time. Technology also will play a part, so that we will develop new ways of understanding patient behaviour, monitoring patients with maybe close telemedicine may improve, and we hope that the whole thing will allow us to have better dialogues with our patients so that patients and doctors come closer together to battling this disease. I've also talked about new approaches to treatment, and the other talk I gave was about the role of inhaled steroids in COPD. Now, this was a pro-con debate, and I said we should not use inhaled steroids in COPD. But that's not completely true. Many of our patients stay stable and they do not need inhaled steroids, and indeed for some of them inhaled steroids will have some risks. But I want to give steroids to the right people, and so there's no doubt in my mind that for some people, maybe 20%, maybe 25% of people who have recurrent exacerbations, recurrent lung attacks, they need steroids as well as bronchodilators. And also we have some look to the future, because blood tests such as maybe the blood eosinophil count can help us predict who will respond and do well with inhaled steroids. So that if you have a raised eosinophil count, then steroids will help you reduce the risk of future exacerbation. So steroids are not for everybody, but for some people, and we can define who that is. And that's so brilliant, because we will give the right treatment to the right patients.
Yeah, and I want to ask you, that kind of congresses, events, all colleagues are getting together. How does this affect the overall global lung health?
It's really important. I think by sharing knowledge and by me listening and learning at the Congress, I take knowledge away, and that allows us to develop the world. I am lucky because I'm the editor of the International Journal of COPD, and the journal tries to share knowledge from all over the world, not just America, not just Britain, not just Western Europe, but actually the whole world, so that we can all learn from each other. The patients we look after are the same. The hearts of the doctors are the same. The treatments are pretty similar, but how we apply them in our culture and in our setting is maybe a little bit different. So we have to learn, but also apply locally.
And at last, do you have a message to the participants at the Congress?
I just want to encourage people. I want to encourage people to work together, to learn together, to listen to their patients, and to do the very best for their patients at every moment, such that we can achieve great things by using patients, by having patient participation, and also giving them the best possible treatment we can. I never want anyone to say to me, my doctor told me there is nothing they can do for me. We can always do something for our patients, and we can learn together to do that better.
Thank you so much for joining us at the studio, and also welcome again to our beautiful country.
Thank you very much.